Well, hearing the words "you've got cancer" can be devastating. Once the shock wears off, patients often worry about how they're going to pay for their care, and then there are the day-to-day costs.
But at Piedmont Cancer Center, social workers are working to connect patients to resources that can help them. The Fox Medical Team's Beth Galvin joins us now to talk about this. Beth?
And Tom and Sine, this is a really common deal that people face, because when you're facing a diagnosis like cancer or another life-altering illness, you need to focus everything you have on the fight ahead of you. And that's hard to do when you're wondering how you're going to pay the mortgage or cover the child care costs and everything else. But there are programs that can help, as Kimberly Carrigg of Haralson County is learning.
A veteran nurse, Kimberly Carrigg of Tallapoosa, Georgia, is now adjusting to life as a patient. The 48-year-old was diagnosed with breast cancer August 5th, the day after she had a biopsy.
I said, oh my gosh, I don't know what I'm going to do. You know, I was already out of work at that point.
Carrigg's doctor contacted Emily Birckhead, an oncology social worker at Piedmont Atlanta Hospital, who quickly called Carrigg, knowing she was probably feeling overwhelmed.
Normally with a cancer diagnosis, they're reeling from that, from recently finding that out, and then afterwards it's this distress of, how am I going to pay for this?
Carrigg, who is the primary breadwinner in her home and had already been sidelined by Graves' disease, is facing 7 more weeks of chemotherapy, then surgery, then radiation.
On average, I would say it could cost somebody around $16,000 to $18,000 a year for cancer costs.
And if you're facing a major diagnosis, Birckhead says sit down and think about what kind of help you need the most right now.
Some of those initial issues like paying your mortgage, and there are organizations out there that can help you with that, or covering your rent for a month maybe, just to help you get through.
By Googling patient assistance programs, you can find nonprofits like Cancer Care, which offers help with transportation, child care, and home needs.
Cancer Care is a big one for our cancer patients. That's a nonprofit out of New York that patients can apply for as long as they meet income requirements.
The Cancer Financial Assistance Coalition lists 15 different nonprofits that can help patients with cancer and those with other serious illnesses. If you're having trouble paying for your medication or meeting your deductible or paying your monthly premium, you may qualify for assistance.
I have had patients use GoFundMe, yes, and get a lot of help there. I mean, sometimes it's difficult to talk to your friends and family about getting assistance, but having a friend set that up for you can really help.
Kimberly Carrigg is grateful for Piedmont's help so she can focus on what's really important, her health.
And not have to worry about what bills coming in and what can I pay and what can I not pay.
And I mentioned that website of the umbrella organization that's made up of 15 different groups that may be able to offer patient assistance. And I've posted that link on my Facebook page. It's Beth Galvin, Fox 5. And it may also be helpful to ask to speak with the social worker at your treatment center, because he or she may know of local programs that might be able to offer some assistance.